What to expect when you're attending hospital for planned surgery. You will receive a letter advising of the date and time for your planned surgery at the Northern Trust. Please read the entire contents of this letter carefully, as it will contain important information about confirming your surgery date, fasting and medication, and what to bring with you to the hospital. You will initially be pre-assessed for surgery by completing a yellow questionnaire. And then, if the pre-assessment team need to see you, they will send you an appointment to attend their clinic. You must attend this appointment or your surgery will be cancelled. If you feel unwell or for some other reason are unable to attend for surgery, please let the booking team know as soon as possible. The contact phone number will be on your confirmation letter. On the day of surgery, it is important that you telephone before you leave home so that we can confirm your procedure is going ahead and advise you of any change to your arrival time. You should have a bath or shower before coming to the hospital. Please pack only what you need, including a dressing gown and slippers, and do not bring any valuables with you. You should also bring your letter and any medications or inhalers that you are currently on in their boxes. Due to limited space and the comfort of other patients, you will only be able to have one person with you on the ward when you're being admitted and prepared for your surgery. Patient and visitor car parks are paid parking, and you will receive your ticket from the ticket machine on the way in. For patients getting dropped off, cars have 10 minutes free time within the barriers before needing to pay. Pay stations are located at the front doors of the hospitals, and rates of charge are clearly displayed. On the way in, you will see signs showing you where to go. However, reception staff or our meet and greet volunteers will also be happy to help you find where you're looking for. Lifts are located just off the main entrance, and stairwells are clearly signposted. You and anyone with you should use one of the hand sanitizers provided before going to the ward area. Surgery is a team effort, and you will meet a lot of different people on your journey. A ward clerk, nurses, an anaesthetist, a porter, theatre staff, and a surgeon. When you arrive at the ward, you should report to the ward clerk and tell them that you are here for surgery. The ward clerk will clerk you in on our system, and you will be asked to take a seat in the waiting area. A staff member will come and get you when we're ready for you. Whilst you have been given an arrival time, please be aware that the time given marks the beginning of your admission process. Your surgery may not be until later that day, depending on where you are placed on the theatre list. As part of your admission, you will be provided with a theatre gown and stockings, which you should put on when asked to do so, along with your dressing gown. You should give your belongings to whoever has accompanied you to the hospital. Your admission process will include visits from various members of the clinical team, including a nurse, an anaesthetist, and a member of the surgical team. You may have already met some of these people if you had a pre-admission appointment. Do not hesitate to ask questions or talk to the team about any worries you have or anything you don't understand. When theatres are ready for you, the porter from theatres will come and collect you. If you are well enough, you should expect to walk to theatre accompanied by a theatre porter and a member of the ward staff. Alternatively, you may be transported to theatre in a bed. If your relative or friend is remaining in the hospital until you are back from your surgery, they're welcome to use the hospital facilities. There are coffee shops, a canteen, a chapel, an ATM and restrooms available on various levels of the hospital. When you arrive at theatres, you will be taken into the anaesthetic room. If you are wearing your dressing gown, you will be asked to remove it at this stage. Here you will meet an anaesthetist and a theatre nurse who will ask you some questions. You may already have been asked these questions before, but it is important for safety checks that you answer them again as truthfully and accurately as you can. It's okay to ask questions or check anything you do not understand. The team will start to prepare you for your anaesthetic, and you will be transferred into the theatre room where you will meet various people who are there to look after you. The monitors necessary for your surgery will be attached, and you will hear beeping sounds coming from the monitors. This is perfectly normal, and you shouldn't panic or worry. The team will keep you informed of what is happening and what to expect as they prepare to begin your anaesthetic. When your surgery is over, you will be transferred to the recovery ward. When you wake up from your anaesthetic, you will have an oxygen mask and monitors attached. This is normal, and you shouldn't worry. The recovery ward staff will routinely check your observations and may provide pain relief if you are in pain or discomfort. The staff will let you know when you are well enough to return to the ward. When you are ready to leave recovery, a nurse and a theatre porter will transport you in your bed back to the ward. Ward staff will carry out the necessary observations and ensure you are comfortable. Please tell them if you are in any pain or discomfort. Your friends and family are welcome to visit during designated visiting times. You should check with ward staff regarding the visiting times, as these may vary from ward to ward. Only 2 people are permitted at the bedside at any one time. Please respect the hospital visiting rules. The ward staff will let you know when you are fit to go home.
So Jane, you've had your surgery. How are you feeling?
Yes, I'm good.
Do you have any pain anywhere in particular?
No.
And do you feel nauseated in any way at all?
No.
Have you had something to eat and drink? Had your tea and toast?
Yes.
Good, was it?
Yes, very good.
Very good. We're going to try and get you home now. So who's at home with you?
My partner.
And he's there for the next 24 hours?
Yes.
Okay. And he's going to pick you up?
Yes.
That's fine. Any problems with your wound or anything like that there, by all means phone back to the ward. Nursing staff will talk you through. Other than that, speak to your GP after it. We'll give him a discharge letter, we'll give one to yourself, which you hand into your GP, and that informs him of what you've had done on this visit to hospital. Okay?
Yes.
Any questions?
You may be prescribed some medication to take home with you. Whilst it's being prepared, you may be transferred to the discharge lounge to be looked after by our discharge nurse. This will allow the ward staff to prepare your bed for the next patient. If you need any advice after you've been discharged from hospital, please contact the ward or your GP.